Hello everyone, welcome to this career counseling session. Myself, Dr. Varsha. I would like to take this privilege to help you in taking the decisions why and why not the MD biochemistry. So, if my audio video is okay, can you please somebody tell me on the chat if I am audible or not? Video is there or not? Privilege to help you in taking the decisions why and why not the MD biochemistry. So if my audio video is okay, thank you, Bhargav. So let's start the session. But I have prepared few things as a PowerPoint slides for you, but I'll be taking questions side by side also. So far you have came across career counseling from so many subjects from various gurus at DBMCI. So I'm hoping most of you have made up your mind, but you are here, so it means you are interested in biochemistry, which is my favorite topic. So first of all, we would take about what is the difference between DNB or MD. Is there any difference? Then the career prospects of taking MD biochemistry. What will be the earning after you finish the MD biochemistry, and then finally the work-life balance. Okay, so DNB biochemistry is considered equivalent to MD actually. There is not much a difference whether you do MD biochemistry or DNB biochemistry. Yes, while taking job in as an assistant professor, definitely MD biochemistry is there. With DNB, few medical colleges may allow you, but still it's a controversy. MD biochemistry can teach as an assistant professor. Okay. We know that you all know, I know that you all know that NEET PG, other than NEET PG, you can say institutes have different exams like AIMS, PJMR, ZIPMER, NIMHANS, right? They are not covered under NEET PG testing. For a duration for MD and DNB biochemistry is both 3 years, right? So what is the difference between the government setup as compared to the private setup? If you do your MD or DNB in the government or the private sector, for the biochemistry I'm talking about, they almost all the same. Either you take a government hospital or you take the private hospital. They have the similar quality standards of teaching, similar academic activities, compulsory thesis for 1 year. Clinical activities are almost the same, like the emergency case handling, surgical exposure, case exposure, clinical case discussion, equipment availability, patient load to be handled, duty hours, night duty, everything is almost the same. Then which one to pick? For me, it is like you have to decide what you want to do after doing the MD. If you really want to become an assistant professor and then maybe go to the research and thing, then you should choose a facility where the teachers, the biochemist teachers, are very good in the theoretical knowledge. But if you want to start up a lab setup or join an industry for the lab testing as a biochemist clinician, then definitely you should join an institute where you have more hands-on, more patients are there, so that you are working more in the lab. Well, few points about the exit exam. For the MD course, it is easier if you get enrolled in the MD biochemistry, because the host institute has both the theory and the practical. So in another ways we can say it is more of a biased thing, whereas in DNB course it is comparatively tough to pass the DNB course, because the theoretical and practical centers are different, and during the practical examination you will not get to see the internals. Usually whenever internal teachers are there, somehow in some ways we get relieved. Okay, internal knows how we usually do, because during the exam many times we have tendency to get nervous, and that day we might not perform better, but being an internal by our side is a kind of an assurance that he or she will give the feedback for us. But in DNB, since there is no internal examiner that is present, so it is tough. If you know the things, if you are confident, it is easier, but if you are nervous and that day is not going good, then it is a bit challenging. In MD course, you can take the practical if you haven't passed the theory. So there is no such a thing, you can pass one at one time. But in the DNB, it is mandate that you have to clear the theory first, you have to pass the theory exam, only then you are allowed to take the practical. Okay. Now after MD, many people are saying what super specialty can go for. Personally, it is like for many other fields, super specialty, going to super specialty is leaning down, or you can say thinning down कि आप कहाँ कहाँ जॉब ले सकते हैं. Then you are a specialized person, you are specialized to do a particular task. But with the MD biochemistry, you can do super specialty in clinical hematology, immunology, medical genetics. These are very good options. Like I'm saying, this is opposite for the biochemist. If you do the super specialty, then definitely you are going in a field where you can earn more money as well as fame also. DM endocrinology is like we are not eligible as a biochemist to enter into a DM of the endocrinology, but hematology, immunology, medical genetics. Since see, after this corona thing has happened to us, there is so much need to do the lab testing. So we as a biochemist are no less than anybody. See, whenever we have a tea tastes most of the times because of the right amount of a sugar into it, right? Similarly, any doctor in any specialty is dependent upon the lab reports, because this is a evidence based data, right? जब तक हम लोग as a biochemistry chemist is not going to give them the reports to the specialist, to any other doctor, they cannot cure the disease. So we are the backbone of the entire medical field. So we should be taking proud, okay, MD biochemistry is not a bad, but it is a very, very good field. First of reason being, we are needed everywhere in all aspects. Whenever there is a health issue, be it a food industry, be it is a pharmaceutical industry, be it a clinical and research industry, be it all other doctors and hospitals and all those research institutes, we are needed everywhere. So there is so like huge demand of MD biochemistry. There is this myth that people say is ki MSc are more required. Okay, no, we have those as opponents. But you are doctors. MD biochemistry has no match to MSc biochemistry or clinical biochemistry. You always and always and always got an upper hand, and life is, let me tell you, is very, very good because you have so many options to explore. You can earn so good. You can like work at 2-3 places, and I'll tell you how you can do that, and you can be really rich in no time with a good enjoying life. Okay. Career options, that is most, कोई भी हम काम करते हैं, then we have to think what we are going to get afterwards in terms of the money, in terms of the name, right? Everybody wants that. That's why everybody goes for it. MD biochemistry is a really good career because you have so many options. You can do the senior residency, whichever college is offering. You can join as an assistant professor, right? But for that you have to do the MD. MD is more preferred as an assistant professor, and salary is good after getting assistant professor. After 5 years of 3 to 5 years of experience with good journals, or let's say you have done something good, you can be promoted to become associate professor, and then soon in 7 or 8 years of the time you can be the dean of the institute of that of biochemistry. And believe me, it's not that difficult. With the assistant professorships, there are good things and the bad things. Good things is it is like kind of a 9 to 5 job. Okay? Your life is easy. You can come home and relax, enjoy with the family. You have vacations, you can go out and you are earning. With being the assistant professor, also side by side you can start doing the research. Okay, if you, let's say, pursue for your own PhD, or if after doing PhD you can assist the other PhDs, then you can get the journals. Let's say you wanted to do some research, you had the passion to do the research, you wanted to learn more about the cancer, then you can really now go in the cancer, work for the cancer markers. There is like hundreds and thousands of things to be done there in the research, and definitely you're going to get the name. And if you get a good patent or you find out something good, you can be a chair of some really good institute. You can join any laboratory services like Dr. Lal Path Labs, SRL, Medanta. There are so many. So this is very interesting. Everybody needs a lab, because lab will give you the results. And for that labs, now the government has said that all labs should be NABL accredited. NABL accredited, good thing is, if the lab is NABL accredited, then they have to hire an MD biochemistry as a signing authority. So you have a job prospects there, number one. Secondly, let's say you are a person who is going to inherit his or her parents' setup, hospital setup. Then you as an MD biochemistry can have the lab, in-house lab, where you can earn more. Remember, you are still an MBBS, so you are a general physician. You can do the lab testing, take the money, then you have the capability to interpret the results. So this is a good combination, right? You can join the biotechnology research institutions. You can go for the funding also from the DBT. They give the funding. You can join. There are like many research institutions which prefer MD biochemistry. I'm telling you which prefer MD biochemistry. If any, let's say somebody is coming out with a new drug, a big company, Ranbaxy, Pfizer, they are coming out with the big Bristol Myers Squibb. They, for the clinical trials, they hire the MD biochemistry for sure. The drug is for the treatment for the oncology, so they may hire an oncologist, but biochemist is must. Because whenever they are doing all the running the lab testing, their blood work, the urine samples, everything, they need the biochemist. And definitely MDs are preferred more and more and more as compared to MSc biochemistry. So you don't have any fight or tussle. MD is an MD, MSc is an MSc. So there is no match. Biotech industry is now a biotechnology industry is looking for pharma industry. Whenever a person is trying to set up a pharmaceutical unit, right, then, or let's say there is a pharmaceutical setup which is going to make an Ayush product. Nowadays, government has mandated that doctors are going to come and visit the facility and endorse, right? Yes, this is a good facility where drugs can be manufactured. So one more scope of you getting a job. Definitely you can go for the PhD. You don't make a good amount of money, but this is for those who are passionate about, who are explorers. I call them as Dora the explorers. You want to explore, okay, what is going on? You are curious, the George the curious. So PhD is a very good field, and you are lucky if you really come up with a good new thing that can be patented for, and that patent is sellable in the market. Then you are safe for the lifetime and you earn very, very, very good. Research and R&D labs, research and development labs, they are hiring now MD biochemistry more as compared to MSc biochemistry, because when it is coming to the health of the people, MD knows more as compared to MSc, because MSc biochemistry they just know the biochemistry. You as an MD know more about the health issues, how this is affecting the other organs, how it is affecting the metabolism, all these things you know more. So you got an upper hand. As a consultant, let's say you do the DNB, right? And DNB actually is preferred for those who want to go abroad. Abroad, you have thousands of options for the biochemistry. In India, it is least explored. because most of the people either they become assistant professor or they open the lab. That's it. Few go for the clinical trial joining also, but less explode are going to join the industry, going for the consultant. In the drug industry, consultants are needed to evaluate actually the pros and cons of using the drug, and for that MDs are preferred again more than the MSc biochemistry, and money is huge. Sky is the limit. More you know it, more you are knowledgeable about your part as a consultant, more you can earn. I know as a biochemist, I can earn $5,000 an hour. I can charge the big companies like, let's say, Bristol Myers Squibb, Novartis. To answer one question, I can charge anywhere just for one question from $500 to $5,000, depending upon my capacity, how much I am expert in the field. And I'm talking about my own personal experience, not just I have read it somewhere. The less taken paths for the biochemistry, as I have told you, the occupational medicine, because of this environmental thing, disaster that is going on. So MD biochemists are harder to test the toxic chemicals in the industrial waste. MDs are biochemists are required in the aerospace medicine. Then suddenly what usually happens when the astronauts, like, they have health issues after they come from the aeronautical space, and before they are going their vitals, what the damage is going on, what kind of shock they get, that time also they need the MD biochemistry because they have to run the test on the astronauts. Medical marketing division and RD division, I'm telling you, is a big time money maker, and this is the future of the MD biochemist, that this here you can make most of the money. Pharmacovigilance is also one option that you can do, but still, like, it is not a huge thing. Making medical reports, going for medical writing, you have other like small competitors, but these are the big time things, and consultant is, being a consultant is definitely a huge thing. Okay, so these are the industries where we can go, like other I have another, let me share this with you. I have another here. If you can see here, employment areas. You can go in hospitals, research services, biotechnology firms, chemical industries, chemical manufacturing companies. Medical laboratories are the options, petroleum companies are the option, pharmaceutical companies, research and development firms is the big time for new drugs. And we say the innovation nowadays is going on because there are so many existing drugs that are already there in the market. Now we want to test whether one drug can be used for another disease. Let's say the antibiotics. There are antibiotics which can be used for the cancer treatment also, right? There are few heart diseases drugs that can be used for the cancer also. So all these things like the research and development, this is called innovation, is going on, and their MD biotechnology biochemist is needed the most, right? Seed and nursery companies, there's so many things we can do as a biochemist. So getting a job is never a problem. It is never exhausted for the biochemistry, right? For the MD biochemist, you can join as an assistant professor, you can be a tutor or demonstrator, a consultant, a laboratory technician, custom lab service associate. Initially, in the beginning, you can join, right? Medical technologist, general physician is the lot like forgotten that you are already an MBBS. So for the private setting, if you have done the MBBS and you do the MD biochemist, and then you are well versed with the let's say few of the techniques that is must, let's say the chromatography, the HPLC. If you know all these small techniques very well, then you can earn really good, and you can run your clinic very well. Right, so these are the top recruiter companies, the pharmaceutical companies, and they are welcoming the MDs also now, right? So important aspect while choosing a college. Remember, all colleges are almost the same. It is the subject you choose the foremost. So you should always have plan A, plan B, plan C. Plan A is, let's say you were shooting for radiology. I don't mind that. Then you are saying that if I don't get that, I'm interested in ophthalmology. That is good. If you don't have that, if you don't get that, then okay, I'll go for the biochemistry. So you always make plan A, plan B, and plan C. And all on these plan A, plan B, plan C, you should pick 5 institutes. कि अगर radiology, if you will get, I'll go for these 5 institutes based upon their priorities. As a for plan B, you pick the 5 institute. Plan C, you pick the 5 institutes. Now, now you have everything on a sheet of a paper, how you are going to decide. Let's say finally you come to the MD biochemistry. You have list of 5 institutes. Which to choose? 2 are the government settings, 2 are the private settings. Which one to choose first? Well, here, though institutes are not important, but I will say as a biochemist, be smart. Be smart enough. What are you going to do after the MD? Let's say you are going to work in the lab, in your lab, in somebody else's lab. That is another story. So that means you need more on hands-on. So the institute you should go for, in my personal opinion, you should pick the institute which has the latest technology, which has more of the patient input, so that you get to you have more samples to be tested. जितना hands on करोगे उतना अच्छा रहेगा. Then you will be having a very impressive hands. Also, you can very confidently say that this much you have handled, these different kind of techniques you have handled. Other way, if you want to go for the research and development, or you want to go for the assistant professor, let's say teaching you want to go for, then you should pick a facility or a institute where there is more emphasis on the teaching, where the teachers are good. And let's say you have planned to do the research and development or do the PhD. So you should always work with somebody. Go for the person who is a very good MD biochemist and is doing very well in the research and development. So you should always go where that person is located. Can you get chance to ask him for the mentorship? So your grooming starts from the beginning, right? And that's how you will accelerate yourself. So you are the best judge how you are going to progress in the life. Biochemist subject is very, very good. MD biochemist is, you should take a privilege to be MD biochemist, because you are needed everywhere. जब तक lab reports नहीं होंगी, lab reports का interpretation नहीं होगा, nobody can get treated for. In India, it is undermined, because that is, again, I'm saying my personal experience. Being a biochemist I was there in US for more than 1 decade. They are always welcomed because we know the most what is going on. And good thing is biochemist is needed in every group. Let's say a group of doctors have very, very complicated case. Then you will be always a part of that discussion, how to treat that patient. Because you being a biochemist, you know which test will give what and what can be the errors, how much you can fine tune the lab tests to get a more accurate result. Given the condition, you know the techniques, you know how to run the machine by yourself. Why that is important? Because until unless there is this old saying, जब तक खुद काम नहीं करोगे तुम्हें नहीं पता चलेगा किससे कैसे करवाना है. Until unless you will know about the dilution, you cannot guide the people who are working under you, द लैब टेक्नीशियंस वर्किंग अंडर यू कि कितना डाइल्यूशन में क्या तुमको रिजल्ट मिलेगा, व्हेन टू स्टॉप, व्हेन नॉट टू स्टॉप. So always and always make sure that if you want to be a successful biochemist, if you want to earn a good name, because with name and fame will come the money behind you. Money is always a secondary factor. If you have a good hands on, money will come after you. Don't worry about the money. Just work on your quality. If you have a good quality as a biochemist, MD biochemist, then money will come behind you, and that will come on more knowledge you have, more hands on you have, how easily you can handle and help the other like doctors or other people to solve the disease condition or the problems out. Okay, so while choosing biochemistry, before choosing it, you should know your strengths and weaknesses. Are you ready to work with the chemicals? Are you ready to accept that others are saying you are not an ophthalmologist, you are not a radiologist, you are a biochemist? Because I'm saying again and again, in India, being a biochemist, we are not preferred more, but we should take this privilege from inside. Yes, we are needed the most, especially after COVID. Labs are needed everywhere. It's a big bunch of the money, right? So if you are ready to work with the chemicals, if you are ready to learn the hormones, if you are ready to work with the enzymes and the proteins, if you want to really know how the metabolism is going on, then this is your area, right? So you, before taking the subject, you should know about the weaknesses and strengths. Don't go by the popularity. If you take a subject which you don't like, then after few years you are going to hate your own life, because this is going to remain, this profession is going to remain with you the entire life. So always be crazy passionate about the profession you choose for. And also the pocket. Why I always say the pocket money is important. See, let's say I came from very like middle class family where I barely was able to pay my tuition fees. So for those, nowadays we have a option of the scholarships. Private colleges, they are like very high in money wise, they are very like asking for high as compared to government colleges. But the other thing about the private colleges and few other colleges are they are asking for the bond also. So let's say I am worried that I don't have anybody for me to help me getting the job afterwards something. So I would prefer an institute which is giving me a bond. So I'm not worried about 2-3 years ki okay kahan mujhe job milne wala hai, where I'm going to go. So this is a good thing. And this, for those who already have their own setup, they have the backup who can help them to get the jobs or set up somewhere in India with good of the hospital. Probably they will not prefer the bond thing. So it depends. First of all, your pocket kitna pay karna hai, how much we can pay. Let's say you don't have the money. Like me, I never had the money, and I got a very poor institute which does not have too many options for the instruments also. I always have, remember, we always have an opportunity to go to another institute when we have the money afterwards and get ourselves trained in those equipment things, right? So this is like, don't too much pressure on yourself in terms of you don't like, in terms of the things you don't like to do, and also in terms of the money, because later on this pressure will degrade you morally as well as mentally, and you will not be able to perform the best, right? Your support system, you always count for the support system, friends, family, relatives, near and dear ones. If you know somebody who can help you to settle, maybe let's say in the US, go for DNB, because DNB give you more exposure to the latest techniques. And after doing DNB, you can take the exams, you can be in the US, take the USMLE exams, side by side you can earn somewhere, though you will not be treated as a doctor there, but maybe a helper or a technician, but then you can become a consultant also. Nothing is difficult. I'm telling you, USMLE is also not a big deal. All you need to know is the basics. Your basics should be very, very strong. Another thing is the area, that is a non-academic thing, and I really truly accept this fact from Dr. Nachiket Bhatia, that area really matters a lot. Let's say you are a North Indian, and you pick a college in southern Indian, which area, like you never lived in that kind of a climatic condition, you are not used to accustomed to their foods, then that is, and you go there just because you just wanted to be in that institute. So you have to mentally and physically prepare yourself for all these things, that you are not going to get the food of your choice, your health is going to get degraded, and the language barriers will be there. Since being a biochemist, we need not to interact too much with the patients, ज़्यादा नहीं होता है, like few cases we do, but usually not, depending upon your mentor, then the language problem will come up. So you have to think for so many things, because once you are in an institute, you are there, like never think of going back. So think about all the aspects very clearly before choosing any institute, which one you want to go for. Okay. I have a question here. Is Tripti, ma'am, MD pathology versus MD anesthesiology in AFMC Bangalore? Well, Tripti, for pathology and anesthesiology, again, I'm seeing this question many times. See, you have to choose which subject you like the most, first of all. Second thing is, let's say you choose, for example, I'm saying, if you choose MD pathology, after MD pathology, do you see yourself settling somewhere with a job? Do you have any connections, or you are confident enough you will crack, or you will pass an interview or something like that? You have to think a lot. Always and always, like, be sure after taking this subject, who is going there to guide me to get a job, or I am capable enough to get a job? Am I ready to take the challenges? Only then choose the pathology and anesthesiology. Anesthesiology, as an anesthesiologist, you have to work with the other doctors. So are you a person who can work in a group? Are you a person who can follow the instructions of the other doctors while in the surgery, in the OT? So if you are not, then the anesthesiology is not for good. Are you a person who are very submissive, can work in a group? Then definitely you can think about it. Anesthesiologists are needed almost everywhere, like a biochemist. जहाँ ऑपरेशन होगा वहाँ आप चाहिए, जहाँ छोटा सा सर्जरी चाहिएगा, you will be needed it for. But that is a group kind of a job. You cannot work independently. You have to work in a group. So think about that, right? Pathology is always a green field. You always have options. You always have jobs. Being a pathologist, same as the biochemist, you can work in a microbiome. You can take the molecular biology always later on. So depend upon. अच्छा, सॉरी कबीर, मुझे नहीं आइडिया था. तो समझिए इस चीज़ को, एमडी को लेने से पहले, बायोकेमिस्ट्री को लेने से पहले, यू हैव टू थिंक व्हाट यू हैव इन योर हाउस, व्हाट यू हैव इन योर पॉकेट. पैसा है, सपोर्ट है, फ्रेंड्स हैं कि नहीं है? डू यू लाइक द सब्जेक्ट और नॉट? इफ यू लाइक द सब्जेक्ट, टेक द सब्जेक्ट. देन थिंक अबाउट इट. आफ्टर दिस व्हाट आई एम गोइंग टू डू. मेरे पेरेंट्स का सेटअप है, वेरी गुड, मेरे पेरेंट्स का सेटअप है, तो इट्स ईजियर फॉर मी, केमिस्ट्री इज गुड, आई रन माई ओन लैब. मैं एक्सटेंड कर लूँगा अपने एरिया को. मैं खाली क्लिनिक की बजाय, रादर देन जस्ट टेकिंग द पेशेंट एंड राइटिंग द प्रिस्क्रिप्शन, आई विल run my own lab setup. That will increase my earnings. Well and good. Do I have connection, or am I going to pick an institution jahan ka alumni is very good? Remember, this is a very great thing about the old big institutions. They have very good alumni, and those alumni always and always support the upcoming doctors. So that is another support system for you to get a job, or you to get a recognition. Not becoming a part of this members and becoming a journal का subscription ले लिया, किसी committee का subscription ले लिया. That is a secondary thing. You will get it like afterwards, slowly and steadily. And if we are really good, community खुद आएगी कि become a part of our institute. Okay. So alumni देखिए, that is very important. Passion देखिए, आपका pocket देखिए, आप अपना future क्या करने वाला है, उन सबको लिखिए. Don't just make everything in the mind, just write down on a piece of a paper, jot everything down, and then circle those things. Okay, I have this, I'm good as a biochemist. Love your subject. I'm telling you, you can earn a lot being a biochemistry. There is just myth that biochemists, they don't get good money, and the thing is, life is very good. You get to do so many things. It is changing. Me as a Gemini, I am always like, I have this, I like the challenges, I need the changing atmosphere. तो बड़ा अच्छा लगता है कि कभी आई एम इन द इंस्टीट्यूट, कभी आई एम इन देयर इन द यूनिवर्सिटी, समटाइम्स आई एम देयर इन द लैब, समटाइम्स आई एम डूइंग द रिसर्च, समटाइम्स आई एम अ पार्ट ऑफ द क्लिनिकल ट्रायल, समटाइम्स आई एम गोइंग फॉर the inspection of a lab or maybe a pharmaceutical industry. So I like this vibrant atmosphere. So if you are that kind of a person, this is your field. This is just go for it. Okay. MD biochemistry salary kitna rehta? That is the biggest question. Average annual salary is almost like 12.1 lakhs hota hai. You can earn anywhere between 4 lakhs to 25 lakhs, depending, I'm telling you, depending upon how well versed you are with the latest technologies. कितने latest technologies आपको आते हैं? Do you know how to run the HPLC? Do you know how to run the calorimeter? Do you know how to use the immunofluorescence? But the immunofluorescence is one of the thing that like you don't get it like in few institutes they have it, but if you know it, then everybody wants you. Really, I'm telling you, there are these few things. And now after COVID, you have these RT-PCR. Most of the institutes, they have bought the RT-PCR. Okay, and that comes for the molecular biology. Molecular biology means we are talking about the genetics. Genetic means we are talking about the gene therapy. You know how many gene therapists are in demand, and it's such a huge like money that is involved. I remember back in US, in Pennsylvania, there is this Pennsylvania University. There is this entire like huge setup for testing the drugs or knowing the genetics, how to do the gene therapies, how the drugs are affecting the genes, like the CRISPR-Cas technology को हम कैसे हरास करके और उसको use करके we can modify the genetics. There is this Children's Hospital of Pennsylvania in which those genetics are being tested on the babies to cure the children which have the inborn errors of the metabolism or inherited diseases they treat for. It's a huge setup, and it's like so much money is involved, and MD biochemist, I'm telling you, is always preferred as compared to MSc clinical. They are MSCs, you are MDs, there is no match. Okay, so for assistant professor, you can earn anywhere between 3 to 7 per annum. I'm talking about. So this depends upon what kind of institute and where it is located. Location is very important. If the institute is in like like rural areas, you don't get much because much of the crowd is not there. Or consultant, this is a very small 3 to 9. I'm telling you, you can earn in CRs. That is my personal experience. You can earn in CRs. You just need to know your subject very well. Lab technicians, medical technologists, these are just the beginnings, and then sky is no limit. Okay. Francis is asking, which is the branch of medicine that deals with learning about cures of viruses? Is it pharmacologist, microbiologist, or PharmD person? Well, for the viruses, microbiologist, they know the more. If you want to go for the virology, but that again depends, are you going to test for the viruses or you want to get the medicines tested for the viruses? But as far as my knowledge is concerned, microbiologist, they know the most. So please talk to Dr. Nasir. He can guide you more on that. Dr. Nasir is our microbiome guru, and he is a gem of a person, so much knowledgeable. Okay, okay, Francis. Work-life balance. One of the last thing for this presentation. I'll take up the questions if you have more. Work-life balance. I remember this when I was finishing up my PhD. I was working all day and all night in the lab. It was very exhausting. I couldn't enjoy any holiday. But one day when I was sitting with my elders in the family, then there's like, beta, इतना पैसा कमाने का क्या फायदा when you cannot enjoy it? And that struck me. If we are earning a lot and if we are working too much, कि हम अपने family, अपने friends को, we cannot have vacation. What is the point? Life is short. Life is big. You have to struggle, but life is again a short. बहुत कम moments होते हैं. So you have to always balance between the work and your personal life. My personal advice to everybody is always take at least one vacation in the 12-month cycle. 2 लेते हैं बहुत अच्छा है. एक vacation ज़रूर लीजिए for weekend 10 days. Go for and enjoy your fullest. Then come back and earn. Second thing is, if you are not a person who can work 24/7, then biochemistry is a very good option for you. Okay, because as a biochemist, you have to just prepare the lab reports. Not just, I should not use the word just, you have to prepare the lab reports, interpret it and type it. So that can be done during the day at your convenience level. There are few emergencies that it is needed right away. Okay, that point of a time you can guide the junior to write all these things, you can dictate it and all that thing. But if you are a person who can work all day and night, then you choose for other specialty. But biochemistry is a very balanced life. You can have your personal life. If you want, you can work all day and night. You can get involved in the research and the development or in the clinical trials where work is going on all day and night. Again, money is very good, right? And it is your life, and live it with the full capacity. You are not going to get it again. Live your dream every day. Okay, हर दिन you should be enjoying कि हाँ आज मेरे को मज़ा आ रहा है. I have to do this. I'm getting this. तो एक स्मूथ सा स्लाइडिंग मोड होना चाहिए. ओके, कि हाँ I'm satisfied, अच्छा मनी आ रहा है, घर पे भी बच रहा है, I can fulfill my dreams. So not it's like कि आज काम करना है, कल काम करना है, परसों काम करना है, छुट्टी नहीं मिल रहा है और ये काम कर छोड़ के मैं जा नहीं सकता हूँ. Don't get engaged yourself that much. Okay, I don't want a perfect life. I want a happy life. This is my blessings to everybody. Just live your happy life, and that happy life comes with the content. Not content, but content means संतुष्टि से आती है. Be happy with what rank you got. With that rank, choose your field. With that field, just 2-3 ऑप्शन हो जाते हैं. तो pick the best you like and enjoy it, accept it with the open arms. Okay, I'm going to excel this field. कोई field बड़ा या छोटा नहीं होता. It is you who is going to make it great. It is you who is going to make your life great. It is you are going to earn very well in your life. It is just you. Whatever field you take, just give your best, learn your best. I can guarantee you money will follow you. You follow the knowledge, you follow the latest techniques, be well versed with the latest things that are going on outside in the world. I'm definitely guarantee you money will follow you. It is just a matter of the time. So enjoy, find the happiness in yourself, and biochemists are no less. I'm telling you, it is a wonderful, enchanting, very live profession, because we get to know a lot every day. We get to see the results every day. We know until unless the lab results are out, it is difficult for doctors to treat the diseases. In India is improving in the medical terms, though in US it is already there. Biochemists are very well respected. So you have to earn respect for yourself by learning this profession well. Okay, if you have any question, if let's say I skipped the question, and if you come up with any question later on, just email me at this dr.varsha@dbmi.edu. I have highlighted this in blue, right? I can definitely answer you that time also, later also. I wanted to show you the preference wise list of the top MD institutes in India. Those who will email me their email ID or send me the number, I can send this to them on the phone or the email. So in this is for MD Biochemistry. This is for MD Biochemistry, right? Chennai, Kilpauk Medical College, Chennai, right? Maulana Azad Medical College, New Delhi. If you are from Delhi, it is a very good one. Government Medical College, Trivandrum is very good. So I have this entire list of the institutes which offer MD Biochemistry. Other than this, I have another this list of institutes which offer DNB, very good institute. The topmost one is Deen Dayal Upadhyay Hospital, Harinagar, New Delhi. If you are from the West Bengal side, the Southeastern Railway General Hospital is the good one. Maharashtra, the topmost is the Jagjeevan Ram Railway Hospital. That is also good one. Baba Sahab Ambedkar in Mumbai is the good one, right? St. Stephen in Tees Hazari here in Delhi, right? It is also good. In Kerala, Little Flower Hospital in Kerala is very well equipped with the latest technology instruments. Okay, and if you want to stay in Haryana, for women's only, right? Bhagat Phool Singh Government Medical College for Women, Khanpur Kala, right? If you are a shy kind of a person and want to just work between the women also, or if you come out from the conserved family, Maharaja Agrasen Medical College, Hisar is also a good one. PGI Rohtak is good one, right? So if you want me to share this with you, just drop me your email ID and share me the phone number on the given email, dr.varsha@dbmi.edu.in, and I'll be happy to share all these things, or maybe any other questions, or let's say if you want a guidance to get enrolled, like to go abroad, especially in US. I have more known in US. Then definitely, if you are not even a biochemist, if you know somebody who is struggling to become a cardiologist or neonatologist, I have my family members who are working as an independent cardiologist in California, so I can hook up them with them so that they can get the guidance, or in the Harvard. Okay, so just drop me an email. If there are any questions, I'm here live for you for a couple more minutes. Otherwise, we will close this session. Myself, Dr. Varsha Gupta. I am a biochemistry guru and I love biochemistry. That is my passion and that is my introduction, because I just want to explore what is going on inside the body. If we eat something, if we are not sleeping well, if we take the drugs. So I'm myself called as Curious the George. Thank you. Good luck for whatever adventures you are taking.